Hi, my name is Jessica Smith. I'm one of the registered nurses and health educators here at the University of Rhode Island Health Services, and I'm here today to talk about birth control options. So when we talk about birth control options here at the University of Rhode Island Health Services, we often refer our patients to a wonderful website called bedsider.org. And on that website, you can see that they break down the different birth control options into different groups. So here on the top group, where they consider them to work really, really well, they have the implant, the hormonal IUD, and the copper IUD, all in that group. The chance of getting pregnant with one of these is less than 1 in 100 women will get pregnant using this technique properly. If we go down here to working pretty well, we have the pill, the patch, the ring, and the Depo-Provera shot. The chance of getting pregnant is between 6 to 9 in 100 women, depending on the method in this group. If we go a little bit further in depth with each one, this is an example of what the Implanon or Nexplanon looks like. It's about the shape of a matchstick, it's a flexible tube, and it goes into your arm. It gets implanted into your arm. It's impregnated with some hormones, so it's going to slowly release those hormones up to 4 years, and then it would get removed. You can remove it sooner, and your fertility would be restored automatically. Next in that group of working really, really well are the IUDs, and these are an example of hormonal IUDs. So this would be the Kyleena, the Mirena, and the Skyla. So these are flexible T-shaped devices that are impregnated with hormones as well, and they slowly release those hormones throughout a 3 to 7 year period, depending on which brand that you choose. They have strings that are attached. The strings are snipped so they're short enough so that they won't interfere, and it won't be an issue when you're having sexual intercourse. Next, we have the copper IUD, which is very similar in shape and size to the hormonal IUDs, but it's wrapped in copper, and it's for women who don't do well with hormones or have a family history, and they are just not willing to go the route of having hormones. Next, in the group of working pretty well, we have the pill. So this is just one example of the pill. There are many different forms and many different brands of pills. This is just one example. So right here we have a bunch of white pills. You would take one white pill every day at the same time every day, as close as possible. And then when you get down here, these are the pills that don't have any hormones in them. So all the white ones have hormones, and then all the ones that are colored, sometimes they're pink, they're green, they're blue, they're purple. Every single colored one down in the bottom row is your sugar pill. So they're there to keep you on target and on a schedule of taking a pill every day, but this is when you would get your period, during that week of the sugar pills. Next, we have the patch. So an example of the patch would look like this. It's a flesh-colored patch. It goes on your skin. Again, this is impregnated with hormones, so you would put the patch on one area of your body, leave it on for an entire week, and then you would take it off and put it on a different part of your body for the next week. On the last week of the month, so that would be after 3 weeks of wearing the patch, you would take the patch off that week and you would not replace it with another one. So that 4th week would be when you would get your period. Next, we have the ring. So this is an example of what the NuvaRing looks like. It's a flexible ring. Again, it's impregnated with hormones. You insert it as if you would insert a tampon. It stays in your vaginal area up against your cervix for a month. And the last week of that month, you would remove it, and then that's when you would get your period with the NuvaRing. The last on the list is a Depo-Provera shot. So that's a progesterone-only hormone. It gets injected once every 3 months. That's by appointment. So you would come pick up your prescription at the pharmacy, bring it in for an appointment, and then we would give you that shot once a month. And from there, we would give you a calendar so that you would know 3 months from that date what your window of opportunity is, so you'd know when to make your next appointment. All of these forms of birth control that I went over, it's really important to remember that you also need to use condoms as backup birth control coverage, just to make sure that you're covered for STI infections, because that's the only true way of preventing STI infections. If you have any questions or concerns, or you'd like to make an appointment, please feel free to give us a call here at Health Services. Our number is 401-874-2246, and you can make an appointment with Health Education to review the different options a little bit more in depth, or you can make an appointment to have one of the providers see you for an initial GYN exam, and then they can go forward with discussing the further options for birth control. We prescribe the pill, the patch, the ring, and the Depo-Provera shot here at Health Services. If you're interested in any of the IUDs being placed or the Implanon or Nexplanon, that would be a referral out to another GYN office where they would take care of that for you. But we're happy to make the referral for you. So please give us a call. Again, it's 401-874-2246. Thank you and stay well.